Hi, I am Dr. Laurie Pozun. I'm a physician here at Lifescape Premier, and I'm really excited to join all of you today just in a discussion on kind of an update on where we're at with COVID, and then just a little bit later focusing on I think the best and latest supplements from a functional medicine standpoint that can really hopefully help to boost our immune system, to allow it to kind of withstand where we're at within this pandemic. And excitingly, a lot of these supplements have some antiviral properties. So I'll share that with you in just a little bit. I just wanted to kind of give kind of a status quo update on where things are in this state. We all watch the news. It can be overwhelming. But we're seeing a massive surge, in COVID cases in Arizona. I mean, from 1 week to the next, cases were up over 50%. And I think more concerning is this surge is really the biggest part of it we're seeing in an age group of 20 to 44-year-olds. I'm sure many of you can kind of imagine why that's happening. I mean, a lot of it really has, I think, to do with non-compliance. I mean, just being straightforward with you. Mask wearing right now is so critical to hopefully flattening out this curve. We're still in the first wave of this pandemic, and there's currently no real end in sight unless we can mitigate this. And just encouraging everyone, no matter what your beliefs are right now. There really is no political influence. This is all based on science, and mask wearing is really critical to help minimize the risk of this further spreading. And so just focusing on encouraging everyone around you, friends, family, everyone, to wear their masks, pay attention to social distancing, hand washing. We don't have to have any major behavioral changes. These are pretty simple things that we can all do to sort of better our community. And really, if not for yourself, really think about just wearing your mask out to protect everyone around you. This is really good for the good of our community, just adhering to these pretty easy methods. I'm as alarmed as you all are to hear that in this state, our ICU beds are nearing capacity. Certainly all of those beds are not taken up by COVID patients, so we have to take that into consideration. But 85% of ICU beds are currently at capacity, and that's expected to spread. It's anticipated even by mid-July, the ICU beds are probably going to be full. I found, I think, an interesting statistic. If we look back in April in Arizona, the average age for patients that were becoming infected with COVID-19 was 52. Right now, in June, the average age is 39. So I think that speaks a lot to kind of that, the importance of people, particularly, well, everyone, but particularly in that age range of 20 to 44-year-olds. Clearly these warm summer temperatures that tend to oftentimes mitigate other infections like influenza are not influencing COVID-19. We're continuing to see a surge here in the desert, tropical places such as, Bermuda, Ecuador seeing an uptick. So really warm temperatures have nothing to do with the virulence of COVID-19. I feel like we've all kind of reached our collective saturation and frustration with wanting to sort of be done with this pandemic. And it's completely understandable. Many of us are feeling kind of claustrophobic, being stuck inside, not being able to get out to do, all the things that we love to do and want to do. And kids are home over the summer. It's kind of a difficult scenario for so many people. But just keep in mind that unless we really all work together on this and do all of the appropriate, and I feel like easy steps, wearing your mask, social distancing, just being aware of your surroundings, and certainly if you're not feeling well, you think you've had exposure, you just take the high road and you stay in. You don't go out, and you arrange to get testing done. It brings up, I think, a good point. Like, it's, with summer, what do we do, with summer plans and kids home, and, summer plans kind of being thrown out the window. And I think, again, you just have to understand that, even though this pandemic is extremely disruptive, it is, we all have to just accept that disruption. And although a lot of people are having a hard time, understandably, with that level of disruption, this is just kind of a little bit of a roller coaster with COVID models of kind of what to expect, in terms of how high the caseload is going to be, and mitigation certainly is not as predictable as we had hoped. So again, just to reiterate, we really just all want to, as a community, do our part to help hopefully slow down and eventually halt this virus. And I do feel like, there's kind of the latest hope and suggestion that hopefully by the first of the year we'll have a vaccine in place, and that's definitely a light at the end of the tunnel, which will allow us all to develop some immunity, assuming everyone will get vaccinated, and then really help to bring this thing under control. Just touching base quickly, because I know a lot of you have had some questions about, what is there to do with summer plans even. So I do want to just kind of touch base just kind of generally on some things to consider, as you're thinking about making some small day trips, or kind of, whatever your summer plans do entail. But it really kind of comes down to, again, just being cognizant of the key things that are typically spreading this virus, and wearing your mask, making sure whatever you're doing involves good social distancing, at least 6 feet apart from everyone else, and just avoiding crowds, So even thinking about things like if you're going somewhere and you have to use a public restroom, that's something to think about. You have to be careful. Public bathrooms are kind of gross anyway. But you certainly, if there's a crowd in a bathroom, you really want to just avoid that. You go in, you kind of do your business. You want to, ideally, if possible, use paper towels to dry your hands. There are some studies that are kind of looking at potential recirculated air within the hand dryers and public restrooms. So just keep that in mind. And if there's an option to do paper towels, then I would use those. Restaurants are opening. If you do, you want to go and mask up, and you want to ideally choose a place that has an outdoor seating area where you're sitting at tables at least 6 feet apart from anyone else. And kind of to the effect of airflow, try to avoid sitting under, vents that could potentially, kind of downwind expose you to a COVID virus if somebody else in that restaurant were actively infected and eating there. So, but the idea is really just, if you have to go out to a restaurant, really just being smart about it and choosing outdoor seating, wearing your mask, sitting at least 6 feet from the next table, and just being cognizant of anybody around you, and kind of looking at the restaurants in terms of kind of how they're dealing with disinfection and things. Many of you have taken up the opportunity, and I think this is amazing, with exercise. And so it's pretty low risk. If you're outside, you're on bike paths, you're walking, really, it is pretty low risk. And again, the key is really just kind of keeping social distance. It's ideal to still wear a mask when you're outside and you're exercising, walking, biking, whatever you're doing, but just keeping the distance from other people when they're out as well. Farmers markets, which are very popular during summer months. If you're going to do something like that, you really want to keep it, just sort of be on the lookout for how orderly the organization is within that farmers market. And there really should be kind of a one-way flow, ideally with one entrance, one exit. Just avoid large crowds, gatherings, Again, kind of wearing your mask and keeping your distance. So those are some important points there. Something to consider if you're on a car trip even with your family, if there's higher risk persons in your family, they may want to drive separately. And, when you're going to be in close confines within a car for an extended period of time, it is, I think, important to continue to wear your mask. Even though it's hot here, maybe keeping a window slightly open so you get some fresh air circulating through as well, to kind of mitigate, risk with COVID transmission. Hotels that's a little, more concerning. I think at least there's some moderate to higher risk with staying in hotel rooms for the summer. You really want to get a good sense of if that hotel is taking special precautions with disinfection, how many, if at all, like how many days in between you staying in a room and the next person would be allowed to stay in that room, if they're allowing some time in between to really clean the rooms and kind of get them aired out. If you have to travel and stay in a hotel, I certainly would keep a stock of Clorox wipes, disinfectant wipes. Make sure you're kind of wiping everything down within that hotel room. Even things like light switches, things that are commonly touched, faucets, really pretty much wiping down all surfaces if you absolutely have to stay in a hotel and travel that way. Gatherings such as parties and barbecues and things, and again, it kind of goes back to those can be higher risk. You are almost certainly going to be in close contact with people. People are going to be congregating, eating, drinking, socializing. So in my opinion, those are things that are kind of best maybe put on the back burner until, this pandemic hopefully slows considerably down. But just keep in mind those are very high risk activities, and if you have to do something like that, again, kind of what we've been talking about, but wearing your mask, keeping your social distance, if there's tables, at least 6 feet apart, and just kind of being smart about that. Camping can be a low risk activity. Again, it depends on the size of group that you're going with. It's always best if possible to use separate tents. Be careful with bathrooms, as we kind of spoke about before, but on campsites, those can be pretty non-sanitary. So you just want to kind of keep that in mind and make sure that you're using special precautions there. And then, at campsites, again, just keeping your distance from everybody else. Swimming is obviously a big one. And there's currently no evidence that the coronavirus can be transmitted in water. But again, it's really through interaction where it's transmitted. And obviously at swimming pools, it's a social experience and, lots of opportunity for that virus to get transmitted. So if you're going to be at a swimming pool, a public pool, even at a lake or a beach, you want to make sure that you're just playing it smart and really kind of keeping your distance from everyone. Again, when you're out of the water, putting your mask right back on. Sports, I have a son that plays basketball, and I am keeping him from that sport. It's terrible for him, but anything indoors right now, just like being in a gym, it's a high risk activity, and so you have to use special precaution with anything that's kind of contained indoors, such as racquetball, basketball. I just feel like that's probably something that needs to be really put on the back burner during this pandemic. And outdoor things, as long as you can keep your distance, playing tennis, golf, if it's outdoor volleyball, things along those, those lines, again, less of a risk, but still wearing the mask every time, and keeping a good distance from yourself and other players or friends that are doing that with you. So that's kind of where I'm at with giving you, an update with what's going on in our community and really what we can all do to hopefully mitigate this. And much of it does involve a lot of just common sense and just remembering, kind of whatever your beliefs are right now, because I'm personally a little bit alarmed. I still go out in public places, the store, I went to the bank last week, and so many people are still not wearing a mask. So even if it's kind of not in your belief system to feel like, this is a real occurrence with COVID, or there's some political influence. It's barely backed by science, and just at this point, the numbers correlate to an escalation. And there's over 3,000 new cases every day in the last week that are being diagnosed here in Arizona. So let's do our part. We're way behind the curve with the rest of the country, and we really want to get out of this black hole, I think, at this point. So now to more of the uplifting part, I think, of my talk today. But I really wanted to kind of do a refocus on what can we do to really help boost our immune systems and hopefully allow us to sort of coast through this with as minimal disruption as possible in terms of potential infection. I do want to preface it by saying that, and again, kind of common sense, but there really is no supplement or drug that's proven to prevent or treat COVID at this point. So there's various supplements right now that have been well studied that suggest at different disease phases for viruses and COVID as well, that they can be helpful to sort of boost the immunity and mitigate the response that COVID is having on your immune system. So just kind of going into that, keep that in mind. And you really always want to work with a functional medicine physician who's well-versed in these supplements, because supplements are really nature's drug, so I think about it that way. They're very powerful, plant-based. They're, nature knew what it was doing when it created these plants that most of these supplements come from. So there can be potential side effects. There can be some dosing differences, depending on your medical history. There may or may not be some supplements that would be appropriate for you, or could potentially, put you at a higher risk of side effects. So you always want to make sure that you're having that discussion with your physician to come up with the best strategy for what's going to work best for you. So to start with, one of the top supplements that I have on my list is a supplement called Quercetin. And just to give you a little bit of background on quercetin, it's a very potent antioxidant. It's anti-inflammatory, and it has actually been clinically shown to have some antiviral benefits against both RNA and DNA viruses. It can work by inhibiting viral replication. It helps to downregulate the inflammatory process. It's pretty incredible. It can modulate signaling pathways. It can be associated with post-viral healing and protecting your body from damage related to free radicals. And again, free radicals are basically released from different metabolic processes in the body when it's detoxifying, when it's working to kind of fight off infection, and those free radicals can be damaging. So quercetin is one of the things that can kind of mitigate that and just keep you healthier. It's the antioxidant-rich plant pigment, just so you kind of know where it comes from. It can be found in broccoli, green tea, berries, onions, citrus fruits. So it's a phenomenal supplement to consider. The next one on my list is curcumin, and this has also been shown to modulate the viral inflammatory process, and it has potential to potentially target COVID-19, the main protease. So some studies are kind of looking at that pathway. It's extremely anti-inflammatory. It's antioxidant rich. It has some anti-tumor properties, and it tends to be really well tolerated. It's found in turmeric root. It's similar in appearance to ginger root, kind of a yellow-orange color, and so that's definitely on one of the top of the list for supplements. The next one is something that's actually found in green tea. It's called Egcg. It's epigalactocectin gallate. So I know that's a mouthful. It's much easier to remember it by Egcg. Again, found in green tea. So, if you drink a few cups of green tea every single day, or it can be found in an individual supplement form if you're not a big fan of drinking green tea. But it does, again, have antiviral action, potentially against COVID as well. And like all good like all good supplements, it has anti-inflammatory benefits. This is one you have to be really careful with. You never want to overdo Egcg because it can cause some liver toxicity. So it's like many things in life, more is not always better. So that's one you have to be really careful with. One of my favorite supplements I'm going to talk about next is N-acetylcysteine, NAC. And this one is pretty incredible. It actually promotes glutathione production, which really is a cellular powerhouse. And it's a protector. It's a potent antioxidant. It works in the detoxification pathways inside of our cells, and it really promotes cellular repair. So you can kind of imagine all of the benefits that NAC could provide your body. Some studies have even shown with influenza, NAC can have some protective benefits in terms of reduction of the number of sick days and the severity of infection if gotten on board, early enough during influenza infections. So NAC it's only available in supplemental form. You can find cysteine in chicken, turkey, yogurt, garlic, and eggs, but the N-acetylcysteine, which is the more concentrated form, and it's really giving you more bang for your buck, is going to be in that supplemental form. The next supplement I'm going to talk about is Resveratrol, and this is a naturally occurring polyphenol. It's a potent cellular antioxidant, and it's again another one of those wonderful free radical fighters. It's really an inflammation buster, and also can have some of those antiviral benefits. Foods that contain resveratrol include peanuts, pistachios, grapes, red and white wine. Be careful with wine though, a little disclaimer there I'm gonna have to say. Blueberries, cranberries, cocoa and dark chocolate, but it is much more beneficial if you take it in supplemental form, because it's gonna be much more concentrated than the amounts that you would get through these foods. It's fairly minute, in these foods. So as a supplement, that is what I would suggest for the resveratrol. Vitamin D. So many of us take vitamin D, and that's a good thing. It's a fat-soluble vitamin, so more is not always better. Your levels need to be monitored periodically with anything that's fat soluble that could accumulate within your cells and potentially cause some toxicity. So again, that's another big reason why you really want to be followed closely by your physician on any of these supplements. But vitamin D basically, when it's activated, it serves as a steroid hormone that is an immune system modulator, and it helps to improve our ability for our white blood cells to fight infection. It's been well known to help, at least be a part of the prevention of upper respiratory infections such as colds. And typically, and again, more importantly, you want to have your vitamin D monitored, but an ideal range for your serum vitamin D level is typically between 50 and 80. So kind of a normal range falls between 30 and 100, kind of right in the middle, gives you a little bit of cushion, 50 to 80 for your vitamin D level. The next supplement I'm going to talk about is melatonin. Many of us are familiar with melatonin as a supplement that can help improve sleep. It actually also has an inhibitory effect on inflammatory mediators, potentially during viral infections such as COVID. And there have been a couple of recently published papers that propose the use of melatonin as a therapeutic agent in the treatment of COVID infection. So that's definitely one to consider and have that discussion with your physician. The next one on the list is vitamin A. This is another fat-soluble vitamin. So again, more is not better. You want to make sure that this one is one of the ones as well that you are under the close supervision by your physician with. It's fat-soluble. It's a micronutrient that's really important for our vision and growth and development, but it also has mucosal protection, so you can kind of see where I'm going with that. But it's anti-inflammatory, can protect mucosa, and is a key player really in the cellular immune response, and also within cytokine production, which can kind of provoke that cytokine storm, which can lead to some of the really severe symptoms of COVID infection for the patients, especially that are kind of ending up in the ICU. So it's one of the supplements that can make a big difference in terms of down-regulating that cytokine response. The next one I'm going to talk about is elderberry, and this comes from different berries or flowers of the elderberry plant. Just kind of a short description on that, but it has antiviral benefits, and particularly when it's taken early on with upper respiratory infections, viral infections, colds. So there is some thought that it could be potentially helpful, if taken early on with when you're suspecting you may have some COVID-like symptoms. Another supplement on the list is PEA. So kind of the long name for that is palmetto ethanolamide. So PEA is an easier way to say this, but it's an amino acid. And this can actually inhibit the tumor necrosis factor alpha. It helps with mast cell stabilization, which can, again, kind of be one of those things that can really help to mitigate this cytokine storm that can occur when we're seeing our own immune system become like hyper responsive to all of the inflammation that COVID can cause. It's really kind of like this, I think of a cytokine storm as kind of this tsunami of an inflammatory response that our immune system has, and this is one of the ones that can, kind of calm that storm down. The next supplement is one of, I think, all of our favorites. It's vitamin C, right? So it's a water-soluble vitamin. It's a big immune defense booster. It supports cellular function. It's antimicrobial, and currently it's one of the supplements that's being used in the ICU as treatment in the severe cases of COVID-19. So I think that kind of that speaks to how effective it really is. Zinc is another one that is very popular right now. Can be a little more difficult to even find in stores or online, but it's been well known to help suppress viral attachment to the mucosa inside the nose or the throat, and thus inhibit viral replication. So it can do a nice job of helping to prevent viral infections, or if you are infected, to help decrease the severity and the duration of those infections. So zinc is definitely one to consider keeping in your medicine cabinet if you have that. It's one that, again, you want to be more careful with zinc. It's not something that you want to take high dose for extended periods of time. There can be definitely some side effects for doing higher dose zinc. It's really just for acute infections, and then you would decrease it significantly, in terms of just kind of putting it on board for you to help with the preventative aspect of it. So again, that's one of the supplements that I really encourage you work with your functional medicine physician to kind of come up with that strategy for you. Some other ones that are a little bit less, I think, well known, but worth mentioning, Boswellia, which is it's a plant basically that produces Indian frankincense. So it's an effective anti-inflammatory. It can be a painkiller to some degree. For those that have arthritic types of issues, it can also help to prevent cartilage loss, and has even been shown to have some effect in different cancer treatments. With Boswellia, the efficacy has been shown to improve even if you're taking it with curcumin. So that's one to maybe double up on if you're going to be doing the Boswellia, to add the curcumin with it. Another one that's lesser known, but I think very interesting, is Natokinase. So this is an enzyme that is basically obtained from boiled soybeans, or it's called natto, and it's an enzyme or protein that helps to speed up reactions that help to support essentially our cardiovascular system and our blood vessels. So think sort of poor circulation, peripheral arterial disease. So natokinase can be a nice adjunct to that, and as I think many of us are aware at this point, there's so much indication that with COVID-19 infections, there's a major contributory component to our vascular system and kind of our immune system attacking our own vascular system, and that's why we're seeing, you know, so many incidents of blood clots and interim complications that involve the vascular system with COVID-19. So the natokinase is really thought to thin the blood and potentially can help to prevent blood clots. Again, this is one that you want to be particularly careful with. If it's thinning the blood, you can imagine some of the consequence of that. Certainly if you are already taking blood thinners such as Coumadin, aspirin, you know, anything that's antiplatelet, you know, NSAIDs such as Aleve or ibuprofen on a regular basis, you want to be really careful with this supplement, and that's another one that you want to have that discussion with your doctor about. Andrographis, I think, is an interesting supplement that's kind of getting a little bit more literature. This is a Chinese herb, and it's a natural immune system booster. It is widely used in China for cold and flu-like symptoms. And it can also fight inflammation, and clearly has been found to have some antiviral properties. So I think we might see, you know, some more studies hopefully being done here with regard to this supplement, because I think it's going to be one to kind of watch out for. This is not a supplement, but I wanted to just kind of end the supplement educational piece with something that I've gotten a lot of questions from my own patients about, but you know, what's the deal with Pepcid, right? So famotidine, which again is not a supplement, but it's an H2 blocker that classically is used to help decrease acid production in the stomach. Allergists sometimes use it because it can have an anti-inflammatory effect. So that's kind of where I think a lot of this is stemming from. But I think interestingly, in China, when all of these COVID cases were coming out and hospitalized patients, they were seeing a higher survival rate in patients that just kind of coincidentally were on Pepcid. Up to a 10-fold decrease in the need for these patients to be on a ventilator. We don't really know why. You know, kind of the studies are still out to figure out exactly what the mechanism of action of that is. But you know, it is one of those things that it's even, I think, right now hard to find on the shelf. So if you're wondering why that is, it's definitely getting some press, and I think it'll be one to kind of watch out for to determine where the mechanism of action is on this. So that kind of ends my discussion on supplements and their benefits. And you know, if there are any questions, I'm happy to try to answer those for you. Okay.
I recently tested negative for a SARS-CoV-2 antibody IgG test.
Mm-hmm.
Exactly what does this mean for me going forward?
Okay, so if you didn't hear the question completely, so a patient is asking and saying that they recently tested IgG negative on their antibody test for COVID, and what does this really mean, and what should he make of this? So on an antibody test, IgG really confirms either if it's negative, that you've not been exposed to COVID, or you could have had such a light infection with COVID that it was maybe kind of subclinical and you didn't have any symptoms. It wasn't enough of a viral load for you to mount a protective immune response. So what we kind of associate IgG with is more of that protective antibody. So what that means going forward, you know, if you do not have a positive IgG result on your COVID antibody test, that inherently you don't have any protection right now. And we don't even really know, quite honestly, what that means. We've seen patients that have had IgG but are still getting reinfected, you know, with COVID. I think again, this is a completely new virus, and we don't know. In terms of our own body's individuality, you know, mounting an immune response, how protective that's going to be. But ideally, with IgG, we are hoping that it would afford some immune protection, that in the event that you were re-exposed, your body would mount an effective immune response to kind of, you know, not have you get reinfected again. So that's kind of where that is at.
I'm scheduled for a routine teeth cleaning. Is it safe to go to the dentist right now, or should I push the cleaning out? I don't have any issues currently at this point.
So that's another one that's kind of in that moderate risk category. And I would say that, and again, you have to kind of individually look at these dental practices. And I mean, they would have to assure you that they're disinfecting everything, to the highest degree, that everybody's got their personal protective equipment and wearing that. Still, given that you're in a kind of a closed, confined area, which concerns me. And again, we're seeing more studies that are showing that even asymptomatic people are passing COVID. So, my concern there is that even with proper mask wear, proper disinfection, there still is a chance that the infection could be passed. Again, you're sitting kind of in closed, confined space for 45 to 60 minutes. So, I mean, my advice would be, if you have no other pre-existing health conditions, you really do your research on, what precautions they're taking. But if you can, I would really reconsider scheduling if it's just a routine visit. If you have an infection or something that's more acute and serious, then that's a different scenario.
What is the status of flu shots at LifeScape? Will concierge patients be notified when flu shots are available?
Yeah, so typically we get a stock of flu vaccinations in September, which is kind of right before we start to see the wave of influenza, and that's typically when it's available. It's a process, where the CDC has to look at kind of what the different strains of influenza are around the world and kind of make their best calculations as to which strains are going to be infecting us, in the next season. So it's a process of determining that. The companies have to manufacture the vaccines. So typically we start seeing those become readily available in September. So we should be following that timeline, and absolutely as we get a better idea of when those will definitely be in stock, we'll be in touch with everybody in our practice.
Is it safe to go to the doctor's office?
Well, so we are here 5 days a week, and I think that depending on how you're feeling, we are doing our very best to sort of minimize risk for any potential COVID exposure. If we have patients calling or showing up with COVID-like symptoms, they're really discouraged from coming in for visitation. We are doing antibody testing here. We're bringing patients in through the back door that potentially have some COVID-like symptoms for testing. So really keeping them away from anyone that's coming in for a health-focused visit, or even for a kind of infection or something that's outside of the range of potential COVID symptoms. So I feel like we are doing our best job to really kind of minimize risk for our patients. Everyone's in masks. Everything is super sanitized. Having said that, it's I see patients. There's some precaution you have to have. And if you're concerned, and let's say you have an autoimmune disease that's maybe flaring up, or something else where you have multiple risk factors, maybe you're on cancer treatment. If at all possible, it's I think a better idea to schedule a telephonic conference with your provider, or a video conference. I mean, there's so many possibilities right now, and that's going to continue indefinitely. So whatever your comfort zone is, I think that's kind of where you have to take it. Anything else? Okay. I so appreciate all of you being with us here today. Oh, one more thing? Okay, one more thing.
are masks fully protective?
So, that's like the $1 million question. Are masks fully protective? I mean, the best masks are the ones that they're using in the hospital setting, which are the N95s. And those are extremely protective, although maybe not fully protective, because we've still seen some cases where fully decked out PPE, in the N95 mask, and ICU nurses and physicians are still getting infected. So I don't think there's any foolproof mask, but the N95s for that setting are the most effective. But they, cloth masks, medical grade masks like you see we wear here in the office, the blue and white masks, they definitely afford protection. I mean, it's science-based. It's really helping, if you're sneezing or coughing, you've got your mask on, sure, some microparticles are potentially going to go through into the environment, but significantly diminished chance of that. And that's kind of what's protecting your neighbors. That's what's protecting, other family members and people in the community. And, hands down, we see a significant decline amongst communities that are mask wearing. So I think that speaks to a lot, It's not, as with most things in life, it's not 100% guaranteed, but it's definitely going to significantly help diminish the chance that this is going to be passed on to others, and hopefully get us on this downward curve so we can get out of this spike that we're currently in. Okay, so I think that's it for today. I really, again, appreciate all of you being here with us, and hopefully we will see you all next week. Have a great weekend. Bye-bye.